instructor, Mr. Mike, and we're about to get started on our full-on CPR with these cool little dummies.
And of course, you may have not mentioned it, but before me coming here, you spent some time online, learning all the basics with an actual online instructor, and it was interactive, correct?
Yes, sir.
Was it easy?
Yes, sir.
Did it have good examples and skills and that kind of stuff?
Yes,
Awesome.
sir.
So now we're going to do very quick hands-on stuff. First, we're going to get into the first aid portion, and the two things I need to see, as you saw in your video, is stopping bleeding and then doing an improvised splint. So we're going to start with the bleeding part. So grab your material there. We're going to get these two things right here. And again, you already saw this, but we're just going to do a quick review, and I'm going to teach you one little thing. So let's just kneel down. Pretend we have a bleed right here in our leg. You press it on there. If it's somebody who's conscious and they're awake, as you saw in the video online, you could ask them to do it. Here, hold on to this for me. You guys, you know, when people are bleeding, they don't just go like this. They go, ah, it hurts. So have them hold on to it. Pressure usually stops bleeding, and then wrap it up. Then I'm going to show you a quick little technique they may not have shown you on the video. All right. Don't wrap it all the way. Go ahead and leave about this much hanging out. Perfect. And then this is just a technique for tying it. I've been going this direction, so I will continue going this direction and grab the middle part. Correct? Then this is one end of a string. There's a little bit more here. This is one end of a string. Here's the other end of the string, and tie a knot. Pressure helps control bleeding. It's a lot easier than trying to find tape or anything else. Perfect. So what happens if the bleeding does not stop?
Take off the right hand and circle back and
You can leave the old one on and just put one right on top. All right, perfect, good. Next, triangle bandage. You can take that off. Good job on that. That's nice. Clearly you did a good job. Good job. As far as splinting is concerned, you use the same technique of wrapping whatever your item is. You can use this if you wanted to. Say, for example, if you could use a book and it's a wrist that's hurt, you can put it like that and then wrap it. Of course, a bigger book would work. And then you want to use a cravat to do a sling. So grab the triangular bandage. And these are just two techniques you might not have learned on the video. One being how to tie off a bandage, and then this is just how to do a simple sling. Grab the top of the triangle. You can see it's in triangular shape. Grab the top of the triangle and tie a knot in the top of that triangle. Once you've tied a knot, you've created kind of a pouch. You can see the pouch right there. So put your hand in the pouch right there and then grab the other two ends. And there you go. This would go in someone's elbow, like this. And there you go. Pat around the knot. So that's a nice simple way to do a sling. Good? Yes. All right, perfect. Next is CPR. You remember the video and your hands up, or your practical little exercise they did. First thing you want to do is see if they're awake. Hey, you, are you awake? If there's no breathing or no movement, you want to get 911 called and have someone get an AED. This is a medical emergency. And then you want to go straight into compressions. Do you remember how many compressions you're supposed to do? Correct. And where is that at?
in between the
Imaginary line in the nipple, right in the middle of the breastbone, using to heal your hand. And how far deep do you do?
inches.
Perfect. All right, you remember well. So go for it. Should be 30 compressions straight up and down, just like that. This is a song of Bee Gees Staying Alive, as well as Baby Shark. Sing it in your head, don't sing it out loud. We don't want to know. After 30 compressions, if you remember, you tilt the head back and give 2 breaths. You pinch your nose and give a breath. And go ahead and do that. You've got a brand new plastic lung in there. Do that twice. And then go straight into 30 compressions. That's perfect. Those compressions look great. Now you call 911 and you ask someone to get you an AED. We'll keep doing that. Hey Ray, found your AED.
Thank you.
And for later reference in this video, welcome to 2020 and the COVID-19. So 4 years from now, when you look in this video, look it up. You'll understand why this distance is important. So that's a trainer AED. There's no live shock coming out of it. But before you plug it in, go ahead and turn it on. You have to press it harder. Just wait. There you go.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
And go ahead and do that.
Apply pads, plug in connector. Apply pads, plug in connector. Analyzing heart rhythm.
Pick up the AED and put it on your side.
Do not touch the patient.
That's what you would do in real life. You'd have it right next to you. So
Shock advised. Charging.
perfect.
Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
All right, you can turn it off. Turn the machine off. Perfect. Follow the instructions. Pretty simple. All right, let's do infants.
Maybe just leave it.
Yeah, leave it there. I'll pick it all up later. When I get to the second scene. So. All right, infant CPR, just like an adult or child, should always be on a firm, flat surface. It is okay to do it on your arm. So the first thing you want to do is make sure they're awake. Hello, infant, wake up, wake up. If they don't wake up, call 911. You normally don't have to worry about an infant AED. They do make them, but you're probably never going to find one unless you purchase it yourself. So once you have nothing, you want to find out if they're breathing. You look at them. There's nothing at all. Straight into compressions. It's in the same spot, but you're using 2 fingers. How many compressions? Go for it. All right, I don't want you to breathe into this guy because I don't have the plastic for you, but you would do the same thing. You'd breathe into him. The only difference is that your nose or your mouth is going over their nose and mouth. They just don't have the anatomy. So you go ahead and pretend, but this is what it looks like. Enough to make the touchdown. Beautiful. Questions? That's it. You're done with the skills. You get your certification in the mail. Congratulations. I shake your hand, but look it up later.